of emergency in every coastal county up Florida's east coast from Miami-Dade to Nassau counties. While current projections have the eye of Isaias remaining at sea, the situation remains fluid and can change quickly. And in fact, the 11 p.m. Advisory from the National Hurricane Center did move the eye slightly closer to Florida's coast. The center of the storm is currently crossing southeastern Bahamas, heading northwest at 17 miles per hour. Projections have Isaias impacting South Florida as early as late tonight into tomorrow morning, with potential to increase in strength to Category 2. The National Hurricane Center has issued a hurricane watch from Deerfield Beach to the Volusia-Brevard County line. A hurricane watch means that hurricane conditions are possible within 48 hours. The tropical storm warning is now in effect from Ocean Reef to the Sebastian Inlet. This means tropical storm force winds are likely within 36 hours. I want Floridians to know that the state of Florida is fully prepared for this and any future storm during this hurricane season. The Division of Emergency Management has had the State Operations Center at level 1 since March, allowing them to actively plan for hurricane season even while responding to the COVID-19 pandemic. Very early on, the division created a PPE reserve for hurricane season. Right now on hand, they have 20 million masks, 22 million gloves, 10 million gowns, 1.6 million face shields, 270,000 coveralls, and 20,000 thermometers. Additionally, at my direction, the division purchased 50 generators to make sure we can remain nimble in the case of power outages. This is the most generators that the state has ever had on hand. Furthermore, the Agency for Healthcare Administration has ensured that 100% of our nursing homes and 100% of our assisted living facilities in the state of Florida have working generators on site. AHCA has also ensured that all 21 of the COVID-exclusive nursing home facilities that we've helped set up to respond to the coronavirus pandemic, that all those facilities also have a working generator on site. Division has more than 9.4 million bottles of water and more than 2.6 million meals ready to be deployed at a moment's notice. Finally, while we do not currently believe shelters will be necessary for this storm, we will be ready if they do become necessary. The division created new and detailed shelter guidance for all counties in light of COVID-19 and has prepared shelter kits with hand sanitizer, masks, and gloves ready to be deployed on request. So the most important thing people can do right now is just remain vigilant and pay close attention to local warnings and local news. Now's a great time to make your disaster supply kit if you haven't already. We recommend 7 days worth of food, water, and medicine. You should presume that if you're in the path of this storm, you could lose power, so prepare accordingly. Make sure that if you do live in an evacuation zone, you know that zone, you know that if you're ordered to evacuate, you take it seriously and follow suit. I've spoken with some of the officials in southern Florida, such as the mayor of Palm Beach County, which looks like the storm will be closest to impact them as of right now. They don't anticipate wide-scale evacuations at this point. There may be some areas, mobile homes, where those orders will be issued, but it's a very fluid situation. We're monitoring the track of the storm very closely. I think what's happened is as it strengthens, it kind of goes east. As it weakens, it goes a little west. And so I think the next 12 hours will be interesting to see kind of where that's going. So just stay tuned on what this is going to do. And regardless of how this storm plays out over the next 24 to 48 hours, we are looking at an active storm season, and so being prepared now is the right thing to do, but it also help you as we see other storms, which will likely form over the next months of hurricane season. So go to floridadisaster.org for information on evacuation zones and supply kits. Stay in tune with the news, listen to the local officials, listen to our updates here at the state. It's a very fluid situation. We hope that it stays off our shores, but we've got to be prepared to have impacts in the state of Florida. With that, I can take a few questions. Yes, sir.
Governor, is the plan still to close all the state testing sites in light of
only the ones who are going to be impacted by the storm? So the ones on the west coast of Florida are open.
And if I could bounce off that, obviously Miami-Dade is where we're seeing the most daily cases reported in general. What do you expect this to do to daily case totals even for the next 2 weeks if we're potentially seeing these testing sites in the hottest areas closed for up to 5 days?
Well, I think it's important to understand that these sites are part of what is done on a daily basis, but they're not even close to the total number of tests that are being done. You have hospitals, you have community things. Our sites, because they're outdoors with tents, if it were to get 40, 50 mile an hour winds, it would just collapse. And so, safety is paramount for that. So there'll still be testing being done. I would also say our testing sites in particularly Miami-Dade have typically run about 80% asymptomatic people. So these are people that are mostly testing. Some 25% of our test takers are curious without symptoms or exposure. Probably got another 25% who are doing it for employment-based reasons. We are actually going to be putting out new guidance to employers consistent with recent CDC guidance. And I was somebody that was really telling employers, hey, we have these testing, let your employees go if you want. Turns out CDC put out guidance last Friday saying that employers really need to go to a symptoms-based approach rather than a PCR test-based approach. If you shouldn't be requiring a negative PCR test in order for someone to come back to work if they've cleared symptoms for a certain number of days. And the reason they pointed to is you can test positive for a PCR test, they believe, for up to 12 weeks. So a lot of the people that are asymptomatic that are testing positive, there is no way for us to know whether that is even live virus. And in many cases, it's not. Certainly, even if you have live virus as an asymptomatic, if you don't get the result back for a week, well, you're not going to be infectious at that point anyways. And so we're going to be putting out, Department of Health is going to be putting out some guidance for the employers. The symptom-based approach is the superior approach according to CDC. And based on our views, or based on the experience here in Florida, I think that that's correct. I mean, I think that, when you have people that can test positive, for weeks on end, we know that there is a relatively short period of time where you can actually transmit this thing. And we do know now more than we probably did a couple months ago the extent to which these PCR tests are doing, the live virus. We're also working on the turnaround time. So we've been able to do some symptomatic lanes, really focusing on those folks, working with labs. And once it gets to the lab, these labs have turned it around in pretty good time. And so we've actually been happy with that. What I think we're going to be able to do, and I'm going to hopefully have an announcement over the next couple days, is have some of our big Miami sites be converted into rapid testing for people that are symptomatic or people that are 65 or older. We're still working on the details, but I think that would be really, really positive, because some of these tests that get reported, I mean, we'll get data dumps for positives that were 3 weeks ago. And so to be able to get, first of all, the patient to get their, or the test taker to get their result in real time, I think is really important. But then that can be reported to the state so that if we know there are this many people that tested positive yesterday, that's a much better way to understand how the pandemic's unfolding than to just get tests dumped on us that have been accumulating over weeks and weeks.
One Goal, One Florida initiative. It's largely the same guidance you have been giving. It's wrapped differently now. Why the change?
Well, we just felt that we actually like some of the trends that we're seeing. If you look at the emergency department visits for COVID-like illness, those have been declining since early July. If you look at the hospitalization trends for hospital admissions, those have been declining. The hospital census in pretty much every part of the state is down from where it was, and so we definitely believe that that we've seen a peak there. So we believe we have momentum, and now's the time to just remind people you can make a difference by following these guidelines. I think a lot of people have been doing that, but I guess the concern would be is if those trends continue in the immediate future, that people think that it's just over. And what we're saying is, let's make sure we're continuing to keep our eye on the ball, focus on going forward. These are very common sense things, that can make a difference. And I'd also say that, we're seeing, positive trend downward in the nursing home staff, nursing home residents. We were concerned about seeing some outbreaks there. So I think that that's trending well. And then what we've really been able to do is provide really crucial support for our hospital system during, they had a really, really challenging 3-week run-up, particularly in places like southern Florida, particularly in places like Tampa Bay. So we surged a number of personnel, medical personnel, many nurses, down to help relieve the burden. I think that's been a big positive. And then being able to have our COVID-only nursing facilities to be able to support, our long-term care folks, the remdesivir, been able to keep that flowing. We're going to continue to do that. So I think that there's a lot of positive indicators, but if people if they follow these basic guidelines, and I would specifically say, the first thing we put on here is protect the vulnerable. And the reason is, I think what we're seeing with the folks who end up in critical condition, what we see with the people who unfortunately end up succumbing to this illness, is you tend to see folks who are skewing older. These are 65 and plus, many of them in their 70s and even 80s. But it's not as much from the long-term care as we were used to seeing. It is more from the communities, and so it's our belief that is really as a result of contact amongst multi-generational families, doing social events, doing family events, which, obviously we want people to do that, but if you're in vulnerable populations, just understand that those have been really significant vectors in terms of spreading it into some of our vulnerable age groups. And so if we really just not only do the basic things, but particularly, if you're somebody who may be younger, practicing the hygiene, doing the physical distancing, wearing the facial covering when you're around people who may be in those more vulnerable, that will really, really make a difference going forward, and so we want to do that.
Back to the storm real quick. Given that it's still a few days away, are you hearing any concerns from South Florida where there's a majority of the cases and where this storm may impact first as far as related to COVID-19? And
so I think the question about how COVID, I think the one thing that we are looking at is some of the agreements that some of the hospitals have to take some special needs folks in the case of storms. Now, obviously, these hospitals do have capacity, I think, if you look at the beds, but there is an issue with the personnel. So I know that's been a concern. I know ACA is working with some of the hospitals. We don't anticipate that necessarily being a huge issue in Dade and Broward based on the current track, but obviously this thing is something that's very fluid, and we're going to have to continue to be willing to respond very quickly to it. And I think, I spoke with the mayor of Palm Beach County today. They feel like they're in good position to respond. Of course, their COVID, I think, trends have been pretty positive over the last 7 to 10 days. Their positivity's down. Their COVID positive patients in the hospital is down pretty significantly over the last 7 to 10 days. So we appreciate those trends, and I want to see those continue. But they feel like they have what they need, but we let them know, look, whatever you need from the state, we want to be there, and we want to be helpful. I am going to be going today. The president's having a roundtable on COVID and the storm, I think in the Tampa area. One of the things I'm going to seek support from, per General Eifert, we want to get the National Guard extended in the 503F extension, and I'm going to ask the president to do that. I think we will get that, but the Guard has had such a huge role in the COVID response. Obviously, they have an important role with hurricane response, but we want to make sure that they're going. That's going to lapse in a couple days, and that will put us in a difficult position as we continue to go forward. So we'll be asking, for some support there, and then also just continued support with some of the other things that they've been really helpful for us with on things like the remdesivir and some of the other things that we've done to really, help our physicians get the care they need to their patients. So we'll have another update. I may be back later tonight, depending on what the storm does for the update. But I would just tell Floridians, particularly if you're on the east coast of Florida, just monitor this thing. It's very fluid. We'll see if there's a strengthening. We think actually that may bow it out a little further off the east coast, but it has tracked a little bit further west in the last, what would you say, 12 hours? It's tracked a little bit further west. So that's just something to keep. Remember, it had initially been on the Gulf of Mexico even, and then they moved it back over. That's probably within 2 days. It's moved all the way over. So that's just how these things are going. So just keep a lookout for what's going on. Make sure you have your plan in place. Our hope is that there will be impacts to Florida, but our hope is that this is not something that is interacting in a significant way with the actual Florida coast. But the most recent forecast, it brings that eye closer to the coast, and so we just got to be vigilant and keep a lookout for what's going on. And please heed the warnings of your local officials. Thanks.